Are you curious about the uses of Lyrica? In this video, we will delve into the common purposes, advantages, potential adverse reactions, dosage recommendations, and hazards of this powerful medication. Whether you're a medical professional seeking to expand your knowledge or someone considering Lyrica as a treatment option, understanding these key aspects is essential. Lyrica, also known by its generic name Pregabalin, is commonly prescribed for various conditions. It is primarily used to treat nerve pain caused by conditions like diabetic neuropathy, fibromyalgia, and post-herpetic neuralgia. Additionally, Lyrica is approved as an adjunctive therapy for partial onset seizures and as a treatment for generalized anxiety disorder. While Lyrica has proven beneficial for many patients, it's crucial to be aware of potential adverse reactions, dosage recommendations, and hazards associated with its use. By developing an understanding of these aspects, you can make informed decisions about your health or provide the best care to your patients. Join us as we explore the multifaceted world of Lyrica and gain valuable insights into its uses and potential considerations. Common uses of Lyrica. Lyrica is prescribed for various conditions, with its primary use being the treatment of nerve pain. Diabetic neuropathy, a common complication of diabetes, can cause severe pain in the limbs. Lyrica works by reducing the pain signals sent by damaged nerves, providing relief to patients suffering from this condition. Similarly, fibromyalgia, a chronic disorder characterized by widespread musculoskeletal pain, is another condition where Lyrica is commonly used. The medication helps alleviate the pain associated with fibromyalgia, improving the quality of life for those affected. Apart from treating nerve pain, Lyrica is also approved as an adjunctive therapy for partial onset seizures. It can be used in combination with other anti-epileptic drugs to better control seizures in patients with epilepsy. Additionally, Lyrica is prescribed as a treatment for generalized anxiety disorder, GAD. It helps reduce excessive and persistent anxiety, allowing individuals to better manage their symptoms and improve their daily functioning. The versatility of Lyrica in treating these various conditions has made it a valuable medication for both patients and healthcare providers. However, it's important to consider the potential advantages and disadvantages before starting treatment. Advantages of using Lyrica. One of the key advantages of using Lyrica is its efficacy in managing nerve pain. Many patients experience significant relief from their symptoms, allowing them to regain functionality and improve their overall well-being. The medication targets the underlying cause of the pain, providing a more targeted approach compared to other pain medications that may simply mask the symptoms. Another advantage of Lyrica is its relatively low potential for abuse or addiction compared to other medications used for similar purposes. As a result, it is often considered a safer option for long-term pain management. This can be especially important for patients with chronic conditions who require ongoing treatment. Furthermore, Lyrica is available in different dosage strengths, allowing for personalized treatment plans tailored to each individual's needs. This flexibility enables healthcare providers to find the optimal dose for their patients, maximizing the benefits while minimizing potential side effects. While the advantages of Lyrica are significant, it's essential to be aware of the potential adverse reactions that can occur during treatment. Potential adverse reactions of Lyrica. As with any medication, Lyrica can cause adverse reactions in some individuals. Common side effects include dizziness, drowsiness, dry mouth, blurred vision, and weight gain. These side effects are generally mild and temporary, often diminishing as the body adjusts to the medication. However, it's important to discuss any concerns or persistent side effects with your healthcare provider. In some cases, Lyrica may cause more severe or less common side effects. These can include allergic reactions, such as rash, itching, or swelling of the face, lips, tongue, or throat. It's crucial to seek immediate medical attention if any signs of an allergic reaction occur. Additionally, Lyrica has been associated with an increased risk of suicidal thoughts or behavior, particularly in individuals with a history of depression or other mental health conditions. Monitoring for changes in mood or behavior is essential, and any concerns should be promptly discussed with a healthcare provider. While these potential adverse reactions are important to consider, it's equally important to understand the appropriate dosage recommendations for Lyrica to ensure safe and effective treatment. Dosage recommendations for Lyrica. The dosage of Lyrica prescribed will vary depending on the specific condition being treated, the patient's age and weight, and other individual factors. It's crucial to follow the dosage instructions provided by your healthcare provider and not exceed the recommended dose. For the treatment of nerve pain, the initial recommended dose of Lyrica is typically 50 mg taken 3 times daily. This can be gradually increased to a maximum dose of 300 mg per day, as tolerated and based on the individual's response to treatment. For the management of fibromyalgia, the initial recommended dose is usually 75 mg taken twice daily, with a maximum dose of 450 mg per day. When used as an adjunctive therapy for partial onset seizures, the recommended starting dose of Lyrica is typically 150 mg per day, divided into 2 or 3 doses. This can be gradually increased to a maximum dose of 600 mg per day, as needed. For the treatment of generalized anxiety disorder, the initial recommended dose is usually 150 mg per day, divided into 2 doses, with a maximum dose of 600 mg per day. It's important to note that these are general dosage recommendations and may vary depending on individual circumstances. Your healthcare provider will determine the most appropriate dose for your specific needs. Following the prescribed dosage and discussing any concerns with your healthcare provider is crucial to ensure safe and effective treatment. Precautions and hazards associated with Lyrica. While Lyrica can be a valuable medication, there are certain precautions and hazards associated with its use. It's important to be aware of these considerations to ensure the safety and well-being of patients. One significant precaution is the potential for drug interactions. Lyrica can interact with certain medications, including opioids, benzodiazepines, and other central nervous system depressants, increasing the risk of respiratory depression and sedation. It's crucial to inform your healthcare provider about all medications you are taking to avoid potential interactions. Additionally, Lyrica may impair cognitive function and coordination, leading to an increased risk of falls and accidents. It's important to exercise caution when engaging in activities that require mental alertness, such as driving or operating machinery. Lyrica is also associated with the risk of dependence and withdrawal symptoms, particularly if the medication is abruptly discontinued. It's important to follow the guidance of your healthcare provider when discontinuing or reducing the dose of Lyrica to minimize the risk of withdrawal symptoms. Understanding these precautions and hazards is crucial for both healthcare providers and individuals considering Lyrica as a treatment option. Exploring alternatives to Lyrica can also provide valuable insights into other potential treatment options. Alternatives to Lyrica. While Lyrica is a commonly prescribed medication for nerve pain and other conditions, there are alternative treatments available that may be suitable for certain individuals. These alternatives may include other medications, physical therapy, cognitive behavioral therapy, or complementary and alternative therapies. For nerve pain management, alternatives to Lyrica may include medications such as gabapentin, tricyclic antidepressants, or certain antidepressants that have shown efficacy in treating neuropathic pain. Physical therapy, including exercises and stretches, can also help manage pain and improve functionality. Cognitive behavioral therapy can be beneficial for individuals with chronic pain, helping them develop coping strategies and improve their overall well-being. In some cases, complementary and alternative therapies, such as acupuncture or mindfulness-based stress reduction, may provide relief for certain individuals. It's important to discuss these options with your healthcare provider to determine the most appropriate treatment plan for your specific needs. When considering alternatives to Lyrica, it's essential to have an open and honest conversation with your healthcare provider. How to talk to your doctor about Lyrica. If you're considering Lyrica as a treatment option, it's important to have a conversation with your healthcare provider. This will allow you to gather more information, ask questions, and discuss any concerns you may have. Before your appointment, it can be helpful to prepare a list of questions and concerns to ensure you cover all relevant topics. Some questions you may consider asking include: what is the specific condition I have that Lyrica can treat? How does Lyrica work to alleviate the symptoms? What are the potential benefits and risks of using Lyrica? Are there any alternative treatment options I should consider? What are the potential side effects and how can they be managed? What is the recommended dosage for my specific condition? Are there any precautions or interactions I should be aware of? By having an open and honest discussion with your healthcare provider, you can gain a better understanding of Lyrica and make an informed decision about your treatment. Frequently asked questions about Lyrica. Is Lyrica addictive? While Lyrica has a low potential for abuse or addiction compared to some other medications, it is still possible to develop dependence on the drug. It's important to follow the dosage instructions provided by your healthcare provider and not exceed the recommended dose to minimize the risk of dependence. Can Lyrica be used for migraines? Lyrica is not approved for the treatment of migraines. It is primarily used to manage nerve pain associated with conditions like diabetic neuropathy, fibromyalgia, and post-herpetic neuralgia. How long does it take for Lyrica to start working? The time it takes for Lyrica to start working can vary depending on the individual and the condition being treated. Some individuals may experience relief from symptoms within a few days, while others may require several weeks of treatment to notice significant improvements. Can Lyrica be used during pregnancy? Lyrica should be used during pregnancy only if the potential benefits outweigh the potential risks to the fetus. It's crucial to discuss the use of Lyrica with your healthcare provider if you are pregnant or planning to become pregnant. Can Lyrica be used in children? Lyrica is not approved for use in children under the age of 18, except for the treatment of certain types of seizures. The safety and efficacy of Lyrica in pediatric populations have not been adequately studied. Conclusion: is Lyrica right for you? In conclusion, Lyrica, or Pregabalin, is a versatile medication commonly prescribed for various conditions, including nerve pain, seizures, and generalized anxiety disorder. It offers significant advantages in managing pain, with a relatively low potential for abuse or addiction compared to other medications. However, it's crucial to be aware of potential adverse reactions, dosage recommendations, and hazards associated with its use. Discussing Lyrica with your healthcare provider and exploring alternative treatment options can help you make an informed decision about your health. By understanding the common uses, advantages, potential adverse reactions, dosage recommendations, and hazards of Lyrica, you can navigate the multifaceted world of this medication more confidently and ensure the best possible outcomes for your health and well-being.